everyone, my name is Zehra, and today I'm going to be talking to you about children dysregulation disorders. So, what is the overview? So today we're going to be talking about what are CDDs, DMDD, disruptive mood dysregulation disorder, ADHD, attention deficit hyperactivity disorder, and then ODD, opposite defiant disorder, and then finally my conclusion and works cited. So, what are children dysregulation disorders? Children dysregulation disorders are mental health conditions where children have significant difficulty managing their emotions, behaviors, and impulses, impacting their daily life, relationships, and learning. Dysregulation means a child has trouble controlling emotions such as frequent anger, anxiety, and sadness. Behaviors include outbursts, aggression, rule breaking, while impulses consist of hyperactivity and poor focus. Dysregulation isn't always deemed as a disorder, and children can temporarily experience it during big life changes or developmental stages. Next, we have disruptive mood dysregulation disorder, DMDD for short. So, prognosis of DMDD. Symptoms may increase over time even with treatment. DMDD usually develops before the age of 10. Without treatment, children may develop depression, anxiety, or behavior disorders as teens or adults. Early intervention improves long-term outcomes. Next, we have symptoms: severe frequent temper outbursts, verbal or physical. Outbursts happen multiple times a week. Child is irritable and angry most of the day, and nearly every day. Symptoms last at least 12 months. These common behaviors occur in more than one setting, like home, school, and daycare, or one of the other, just home, just school, or just daycare. Okay, next we have biological causes. Brain areas for emotion regulation may work differently, like the amygdala and prefrontal cortex. Family history of mood disorders such as depression, bipolar, and anxiety. Possible chemical imbalances in mood-related neurotransmitters like serotonin. Environmental causes. We have chronic stress at home, family conflict, abuse, or neglect, inconsistent parenting or harsh discipline, exposure to trauma or early life instability, poverty, unsafe neighborhoods, or peer influence. Next, we have medications for DMDD. Stimulants if ADHD is also present, antidepressants like SSRIs, atypical antipsychotics such as risperidone for severe outbursts. Meds aren't the immediate go-to for DMDD, but it is only considered once therapy is done first. Then we have therapeutic interventions. Cognitive behavioral therapy helps children recognize and change negative thoughts, including teaching coping strategies and problem-solving skills. And dialectical behavior therapy for children, DPTC, focuses on emotion regulation, distress tolerance, and mindfulness, and helps them handle their big feelings. Okay, next we have ADHD, attention deficit hyperactivity disorder. Prognosis of ADHD, lifelong condition, but symptoms can improve with age and treatment. Many kids learn coping skills and do well with support. Some continue to have symptoms even into adulthood. Early diagnosis and treatment lead to better school, social, and life outcomes. Next, we have symptoms of ADHD. ADHD has 3 types: inattentive, hyperactive, impulsive, and combined. Inattentive type is trouble paying attention, easily distracted, forgetful, struggle to follow instructions, and makes careless mistakes. And hyperactive impulsive is fidgets, can't sit still, talks too much, interrupts others, and acts without thinking. And these can combine together. Both these symptoms can occur at the same time. Okay, biological causes of ADHD. Genetics, ADHD tends to run in families. Differences in brain structure and activity, especially in areas controlling attention and impulse. Lower levels of dopamine, which is a brain chemical released to focus and reward. Related to focus and reward. Next, we have environmental causes of ADHD. Prenatal exposure to alcohol, tobacco, or drugs. Premature birth or low birth weight. Exposure to lead or exposure to lead or environmental toxins, high stress or trauma in early life, parenting styles or chaotic environment do not cause ADHD, but can affect how symptoms show. Next, we have medications for ADHD. Stimulants like Adderall, Ritalin, and Vyvanse help increase focus and self-control, work quickly, often within 30 to 60 minutes. Non-stimulants like Strattera, Intuitive, used if stimulants cause side effects or don't work. Next, we have therapist interventions. Behavioral therapy teaches children to manage behaviors using rewards, routines, and consequences. And we have also, again, cognitive behavioral therapy, CBT for short, helps older kids and teens change negative thought patterns. Okay, next we have ODD, opposite defiant disorder. Prognosis of ODD. ODD can improve with early intervention, especially with therapy and family support. Some children outgrow ODD, especially if treated early. If untreated, it may lead to conduct disorder or problems with school, relationships, and the law. Better outcomes when families, schools, and mental health providers work together. Next, we have symptoms of ODD. Frequent arguing with adults, easily annoyed or loses temper fast, defies rules or refuses to do what's asked, deliberately annoys others, blames others for their own mistakes, angry, resentful, or spiteful attitude. Next, we have biological causes of ODD. Family history of mental health conditions like ADHD, depression, or related to emotion. Differences in brain chemical in areas related to emotion control and decision making. Possible chemical imbalances like in neurotransmitters such as serotonin and dopamine. Next, we have environmental causes of ODD. Inconsistent discipline or harsh punishment at home. Family conflict, neglect, or lack of supervision, exposure to trauma or chaos in early childhood, poverty, poor school support, or negative peer influence. Next, we have medications for ODD. Medication is not typically used just for ODD, but may be prescribed if another condition is present like ADHD or anxiety. Stimulants if ADHD is present, mood stabilizers or antipsychotics in severe cases, antidepressants if depression or anxiety occurs. Then we have therapeutic interventions, parent management training, teacher-parent teaches parents to use positive reinforcement and consistent consequences. And then again, CBT, cognitive behavioral therapy, which is a common use of therapy for a lot of these dysregulation disorders, helps the child manage anger, solve problems, and control impulses. Social skills training teaches children how to interact respectfully and share and handle frustration. Family therapy improves communication and reduces tension within the relationships. Okay, now we have a conclusion. So we basically went over how child dysregulation disorders like ADHD, ODD, and DMDD affect emotion and behavior control. They're caused by a mix of biology, environmental, and the environment, and symptoms impact school, home, and personal life. So overall, with early treatment, therapy, support, and sometimes medicine, these disorders can be overcome over time, and it's nothing to worry about. It's just something to keep in mind in young children. And with support, children can learn to manage their emotions and thrive. And this is my works cited. I hope you liked my presentation on children dysregulation disorders, and I also hope you learned something new. Thank you so much.